welcome all to the first national webinar of the Ayush Valley Foundation. The Ayush Valley Foundation is very delighted to welcome a very select group of participants here today and panelists. We are here today with three participants: Dr. Amrita, my co-host, joining from Kochi in Kerala, and Dr. Varghese Thomas joining us from Bangalore, from the Trans Disciplinary University in Bangalore, and our chief guest for the day, Dr. D.C. Katoch, advisor to the Ministry of Ayush, Government of India, joining us from New Delhi. So welcome all. Before I start off, I just want to tell you a little bit about the Ayush Valley and the reason for this Ayush Valley and the thinking behind the Ayush Valley Foundation. India has been making great progress in promoting Ayush systems around the world. And there is much more work that can be done. There can be more stakeholders in this whole process of taking the benefits of Ayush systems to the world. And we felt that Kerala had a special place, along with all the partners from India, from across India, to provide a new, invigorated thinking about Ayush systems. And we felt there was a tradition in the length and breadth of Kerala that would benefit the world if we came together as a team. And this was the whole idea of the foundation, to gather all the strengths of Kerala's tradition and connect it with the traditions from around India and provide a focal point for the world. To more than taking Ayurveda out to the world, we want the world to come to us. And we thought if we could capture all the strengths that we have across India and give it one home, then this will be a central place from where people could connect with the Ayush systems. Kerala is additionally active in all the modalities, not only Ayurveda, but also yoga, Unani, homeopathy, Siddha medicine, naturopathy. There are practitioners of this along the length and breadth of the small state. Additionally, we were excited that we had an opportunity to connect with a very old organization, said to be the oldest hospitalized kind of hospital form of Ayurveda, the Kerala Ayurveda Samajam, which is located in a small town in Kerala called Shornur, along the banks of Kerala's longest river, and a very important river, the Bharadapura, also known locally as Neela. We are fortunate that we could connect the strengths of the Ayurveda Samajam and also a college associated with the Samajam, the PNNM College Ayurveda. They are situated on the banks of this beautiful river. The river has been a home for learning and training for millennia. As far as we know, people have visited this part of India and know the river. Large communities have settled around the sites of this river. Homes of learning for Ayurveda are still found around the banks of the river. So that is the reason for the valley. And we felt that together with the power of the internet and what it offers, it will be much easier to reach out to this webinar. A few other points. Along with us today are as the network grows, we are reaching out into the world. We have Dr. Suresh, who is joining us, Dr. Suresh Babu, also an Ayurveda student practitioner now in the United Arab Emirates. So Dr. Suresh Babu, welcome to the Ayush Valley Foundation. We also have Mr. Jairam, K. Jairam, who's joining us from Africa. And Jairamji is also looking after our finances and accounting systems, etc. But he's passionate about Ayurveda, and he's our first entry into the large continent of Africa. And from there, we hope we can touch the 55 nations of Africa, from beautiful Botswana out to the 55 nations of Africa. So welcome, Jairamji. I'll pass over for Jairamji and Dr. Suresh just for a few words. Jairamji, if you wanted to tell us a little more about how you feel to be connected with the foundation and your vision for Africa, please.
Hi everyone. My name is Jairam. I'm a practicing chartered accountant in Botswana for the past 25 years. I'll be the one who will be coordinating the efforts of Ayush Valley in Botswana and the whole of Africa. Thank you, Dr. Madan, for the introduction.
Thank you so much. We welcome you, and we look forward to Africa. Is very important for all of us, and yes, you're going to be central to this activity in Africa. Dr. Suresh, welcome to our foundation. Thank you for joining us today. A few words from yourself before we pass the microphone on to Amrita, my co-host. Thank you, sir, for joining us. You have to unmute. You have to unmute. Thank you. Thank you, Dr.
Yes, I am associate with Girish and all these people. So happy to join this one.
Thank you so much for joining us. I also want to thank our promoters, strategic partners for the activity. We have Samajam, which is the foundation for all of us and inspiration for all of the Ayush Valley activity. Ayurveda, the magazine, Ayurveda Health Tourism, and Benny Thomas is here. Benny, would you like to say a few words? Benny Thomas, the editor the chief editor, managing editor, director of Ayurveda Samajam, Ayurveda magazine. Benny.
Thank you so much, Dr. Madan, for a nice introduction, and wish all the panelists and the attendees all the best. Thank you.
Thank you, Benny. Thank you. Benny's magazine is very important. It's been running for, I think, almost 15 years, and he has editions in many languages, of course, in English and several other languages. Please do visit the Ayurveda Health Tourism for almost daily updates on Ayurveda globally. And finally, I want to thank Top Spot Pharma. I don't know if Girish Etan is here. Girish, Top Spot Pharma, for helping us, for being a partner here. And also, most of all, the staff at Ayush Valley for holding hands and keeping this activity together. I want to introduce my co-host, and who will then take on to introduce others. Dr. Amrita, who is joining us. Amrita, thank you for joining us today. Amrita joining us from Kochi. Amrita is an Ayurveda graduate and an MS in Ayurveda. She has done her research and she has studied at the Ayurveda college run by Amma. And this is a very big establishment in Kerala. They have a lot of activities. They run a whole university, and Amrita studied there. She comes from a family of Ayurveda practitioners and scholars, and she's done work on aspects of bone healing. She has worked with some Kerala formulations that are unique to aspects of bone healing and wound healing. And we are very fortunate to have her with us. Amrita, so all yours. Thank you for joining us as a co-host. You're all yours now.